thought about what beauty is? Beauty is biology, and the human desire for beauty is genetically programmed. Beauty is a social currency that rewards the lucky beholder. Beauty is not one size fits all. Hi, I'm Dr. Monica Bonakdar. I'm an aesthetic medicine specialist practicing in Newport Beach, California. I'm the creator of Monbon Clinical Skincare and Amplify Filler Technique. You are listening to Beauty Heroes Podcast, where I chat candidly with trailblazing beauty leaders, examining, questioning, and challenging everything you thought you knew about beauty and the current beauty standards. My goal is to make beauty more inclusive and accessible to all aesthetically oriented men and women. All right, let's do this. Hello, everyone, and welcome. Today, we are speaking with Tim Shanahan of Revenue Cure, and he's going to educate us on his new device that is FDA cleared and available in the U.S. called Frozen C. Welcome, Tim.
Thank you. I'm glad to be here, Doctor. You're just one of the physicians that I've always loved working with, so I'm honored to be here. Thank you.
I'm so excited to talk to you about Frozen C. This is really a technological breakthrough. And to start out with, let me just say that this is being used for medical therapeutic treatments as well as for aesthetic treatments. And it falls into the cryotechnologies and this cryo-craze with everyone stepping into cryogen chambers, but this, amazingly enough, can be used on the face. So, Tim, tell me about Frozen C and the science behind it.
And that's it's there's so much to it, and seriously, on a daily basis, it seems to keep expanding. But I'll break it down in a couple sections. Number one, Frozen C is really it's a pain device. So one of the things that it does, and it's cryogen. So everybody hears about all the cryo-craze and all of the cryo chambers you can go in, and they use nitrogen. And nitrogen is like minus 278 degrees. So it's really cold, but they can put it on as a mist. And when you look back at all the clinical studies over the last, 80 years, everything has been done with liquid CO2, and that's minus 78 degrees. The problem you have with both of these is how do you deliver this to a patient in a concentrated, safe manner? Way back when, they used to just dip it in with cotton balls or swabs, and they would brush it over a face, and if you get a drip, well, sometimes you get a burn.
A blister.
Yeah, a blister, and you don't get that concentration that actually gives you the results that you're looking for. So with the Frozen C, what we've done is have a self-contained cryo tank within inside of it, and it's minus 78 degrees. But at the same time, we're monitoring the skin temperature while we're delivering the cryogen. So it comes out, it's high pressured, so you've got a nice breeze pushing product in, getting that minus 78 degrees on the face. So what happens is we're measuring the skin temperature so that if you get below like 10 Celsius and then you get to 5 Celsius, the system will give you a warning and say, hey, you're getting really cold at 5 Celsius. And at 3 Celsius, it will shut off so that we're not getting the blisters and we're not getting the burns on the patients. So you can deliver it, therapeutically for the patient. And the other part is now you're getting the reactions you want. So the reason why we're using CO2, a couple of reasons, but we also get the Bohr's effect. So when you treat around the face, you'll notice that when you go near the nose, the body has an automatic response to a proliferation of CO2, and it senses a lack of oxygen. So what happens is the body responds with opening your mouth and trying to get more oxygen, but at the same time, your body is rushing blood flow to that area with oxygen because it senses there's a lack of oxygen there.
Bohr's effect kind of reminded me of my physics classes, and the hairs on my arm stood up, but I'll try and listen and not block you out. So this opens up the vasculature.
Yes.
Because it is thinking that there's no oxygen around because of the initial closure of the vasculature. So it goes into an opening and closing of the blood vessels. Is that what you're telling me?
That's part of it, but it really is just a response to CO2. Your body senses that there's just a lot of CO2 and no oxygen. So it wants to get oxygen. It's just like when you yawn. The Bohr's effect is really just a yawn response. It's the same thing, because if you see somebody else yawn, your body senses there's a lack of oxygen. So you automatically yawn to fight for that oxygen. And that's instinctively in your body. So it's really interesting. And then the other part that's real simple is everybody knows what frostbite is. That is considered the Hunter's effect or the Lewis reaction. So the first thing that happens is if you stick your finger in snow, your vessels, they constrict. So you get this constriction and the blood flow runs away because it's cold. Well, once you get to the 10 Celsius, your body starts to react and say, wait a minute, I'm going to have frostbite. I'm going to lose that finger if I don't increase the blood flow and get oxygen and blood flow to that wound or that finger. So we get the Hunter's reaction, the Lewis reaction to the face. So what you're getting is this massive proliferation of oxygen and blood flow because it goes into vasodilation to save the skin, although there's no risk because we're automatically shutting off at 3 Celsius. So your body has that reaction to get the blood flow, get the oxygen, and that's really what creates the collagen and the elastin. And as you get older, it's the lack of blood flow in your face that you're not seeing the results and you're starting to age. This helps reduce that.
Wow. Okay. So I was wrong then. There's a Bohr's effect, and that's directly having to do with CO2 and oxygen starvation. And then there is the Hunter's effect, and that's the vasodilation.
Correct.
So tell me, how do we use this in aesthetic medicine? What does this have to do with aesthetic medicine?
It's the part that we're so excited about because every office that is taking this on, they just keep finding other things to do with it. Number one, you're going to do a cryofacial. So you can do the cryofacial, which is going to get you tone, texture, and everything you want. It's very simple. It's a 10-minute procedure, doesn't hurt. So it's just this comfortable blowing and cold on your face. So you love that. Where we're seeing everybody really take off with it is on every single filler or Botox. They're giving them a nice little 30-second shot on that area. Then they're injecting painlessly, because what happens is once you get below the 10 Celsius, your nerve receptors are shut off so it doesn't send the pain signals to your brain. So it makes it so much more comfortable. And one of the big problems with fillers and all these Botox and everything else is, well, when you do the injection and then you end up with this swelling, inflammation, and sometimes some bruising. Well, this dramatically reduces this, if not just eliminates it completely. So you can do the lips painlessly now.
Wow. So other than the cryofacial, this is being used, the frozen C treatment is being used pre-facial injectables, not only for pain control, but also to decrease and eliminate possibly bruising.
Correct. And post. So even afterwards, then you'd go back over those areas that you injected just to keep the inflammation down as well.
Oh, so it's the 3 arms to this: painless, bruiseless, and swellingless.
Correct. That's absolutely it. Now that's just one part of it.
Okay.
Then you start talking about acne. Well, the beauty part about using the CO2 is that in surgeries, if you can't autoclave something, they actually use liquid CO2 to kill the bacteria. It's actually a sterilizer.
Is that what gas sterilization means?
In some instances, yes.
Okay.
And it depends on the device and how they're using it. But the beautiful part is we're sterilizing the skin. We're killing the bacteria. So even before you do the injection, we're killing the bacteria so you know it's safe to inject. Well, that also works straight across the board when you're doing active acne. When you're doing any procedure, you hit them with this real quick. You get them down to the 15 Celsius and you've just killed the bacteria. So now you've got a clean palate to work with. After you do an acne extraction, even before and after, but after acne extraction, you've taken out all the blackheads. Well, now you use the frozen C to kill the bacteria and close the pores and get the blood flow going. And we're seeing phenomenal results on that as well.
Oh my gosh, this is really amazing. So in my practice, as you know, I have a lot of people coming to me for skin rejuvenation and also for facial injectables. I don't have a big acne population, so I hadn't even realized that we could use it for acne. What else, Tim? What else does this fancy device of yours do?
Okay. Well, the other one, which was a surprise that we found in the clinical study, was rosacea. We've gotten some really great results on the rosacea because what happens is, just like with the Hunter's reaction, where you're treating with the frozen C and you've got the minus 18 or you've got the 10 Celsius, what happens is you get vasoconstriction. Well, what's happening on the rosacea, we're constricting those vessels and actually shutting them down. So we've got some great results on that as well.
Is that a temporary effect?
So far, one of our test patients, we did 3 sessions and she still is not as red as she used to be. I mean, it's dramatic reduction. So is it going to work that way with everyone? We don't know yet. It's one of those things that I hope to do a study on in the near future and actually really push it. So we're excited to see what happens on that.
Wow, that's incredible. Right now, what I am using for rosacea is IPL treatments, and IPL is not painful, but it's not painless either. So to substitute a treatment that requires numbing and it's kind of like touchy to do with a painless 10-minute treatment is just amazing.
Then you look at, okay, Ultherapy. If you're doing Ultherapy, you know how you get there's the red, the inflammation. This is going to reduce that red inflammation. It's going to reduce the pain dramatically, even on tattoo removal, even on doing threads. If you do threads, you do it at the same time. It's incredible. You know, we have one person that's firing it while you're putting in the threads, and the pain is dramatically reduced. Where we're having a patient, we tried to do a split face, and the patient said, "Are you out of your mind? I will not do it again without the frozen C." And and you can't argue. Yeah, we were thrilled.
So it's not just for facial injectable pre and post treatment. It's really for anything that causes some pain and discomfort during the procedure.
Yeah. You look at tattoo removal. It's phenomenal for tattoo removal and fractionated CO2 or fractionated erbium. I did a live patient up in Danville this week, and we did a CO2, and really we did it pre-CO2, numbed them a little bit. Then we were doing it while we were treating with the CO2. And we said, again, we tried to do a split face, and the patient said, no, bring that back. and then, the big part of when you do microneedling or you do CO2 afterwards, you've got that burning sensation. The heat is just really, really pronounced. Well, what we've done is we took the patient that right after that CO2, which was an 8 in the pain scale, we dropped her down to a 2 in seconds. And she just sat there, and we hit her with the frozen C for about 3 minutes after the CO2, and she was in heaven. And she actually even said, "This is heavenly." And we were just like, yes.
So how long has frozen C device been available in the U.S.? You brought it to the U.S.
Yes.
You went and found it. You were on a exploration around the world for the next big technology. You found this, you brought it. When was that? November
of last year.
2018.
Yeah.
Wow. So, Tim, it hasn't even been a year.
No. And it is blowing up. And then, of course, we had to set up all the marketing and all that stuff, all the stuff that we've gotten, and put that together and really work on a nice rollout. And we're excited. I mean, it's taken off 10 times more than we had hoped for.
So the scientists that made this device, they were mostly in the laboratory and didn't give you a whole lot of data about the patient benefits of this device.
Well, it's funny because it was developed in Korea. Korea makes phenomenal products, and what they didn't know is that they were going to use it strictly for just a pain laser. I mean, really, they were talking about just using it for sports medicine, even CBD delivery. Okay, it's phenomenal for that.
What?
Yes.
Are we talking marijuana here? my PG-rated podcast is now talking about CBD. Oh my goodness. Okay, tell me all about that.
So what happens is if you put the CBD oil on, let's say it's a shoulder, somebody's got shoulder pain and inflammation. You put the CBD on, you let it sit for about 3 minutes and absorb. Then you hit them with the frozen C. And what happens with the frozen C, it pushes that product in, but it also, remember, it creates that Bohr's effect in the Hunter's reaction where you get the vasodilation. It goes up. All the oxygen and blood are going to that area and grabbing that CBD oil and getting it to where it wants to be and needs to be.
And it's acting as an anti-inflammatory pain reduction for joints and cartilage and muscles. Is that what it does?
Correct. And truthfully, the next area I'm going with it will be wound healing because of the Bohr's effect, the fact that it kills all the bacteria. I'm going to be going into doing some wound repairs, even diabetic ulcers, because diabetic ulcers are something where the patients don't have the blood flow to heal themselves. So what we can do is kill the bacteria, close it up, and get that blood flow to heal them. So that's the next step that I want to get into.
So this device came from Korea, and they had figured out that this would be a good thing for sports medicine. When did you discover this device, Tim?
Well, it actually came, because I launched the Vivace and I also launched the Med Lights in the U.S. I developed the Revlite laser for tattoo removal when I was back running Hoya Combio before Cynosure bought them. And what happened was they came to me and sent it to me and said, hey, like right now I've probably have around, I'd say 20 companies that have devices that they want me to launch into the U.S. because I have an FDA team, I've got a clinical team, and I've got a distribution team. So we've got the trifecta there to bring it all
I
in.
want to come to your, where's this? Not in a garage, I hope. I want to come to your office for like a field trip and see what all you have, what's coming up. So they sent this to you and said, hey, take a look. Do you want it? Do you want to be the distributor for this?
Right. And I don't do anything unless I'm the worldwide distributor because what happens is it blows up. Once they see the marketing and they start to see what's happening in the US, everybody jumps on board, worldwide.
Yes.
We're the catalyst here in the US and everyone knows that. And that's why, products are being brought to us.
So they come from the scientist laboratory to the U.S. and then from U.S. they are gobbled up by other countries. Is that how it goes?
Well, see what happens is like right now I have all the countries are reaching out to me to get the distribution rights in their country. I've got a couple international managers that work with me that run around and set up each country. Our FDA regulatory guy, Tim Duggins, he goes out and does the regulatory for every country and gets us cleared that way. And then there's some products, that they want to bring into the U.S. and what they want us to do is really just repackage them and manufacture them in the U.S. because a U.S. product will sell at a higher price point everywhere else internationally than taking, let's say, a Korean product and trying to sell that internationally. And that's one of the reasons why they want to have the manufacturing done in the U.S.
So, I mean, it's not just the name Made in USA that's doing it. Tell our audience what really happens behind the scenes to get a product to be approved for use. That higher ticket price comes with the assurance that this is a safe and effective device. So tell me about that process.
Yes, and that is it's a complicated process, but if you have someone like we do that knows the process, in fact, Mr. Duggins, who is part of our FDA team, he
Yes.
actually does a lot of the instructions to the FDA. He will go out and do classes for them.
So bottom line, you have to get an FDA approval to be able to sell a device to a physician, and the physicians can only purchase devices in the US that are FDA approved. They can't just go and find something in China and say, hey, I want to have this in my practice. That's illegal.
It's illegal, but there are people that are doing it. And also I want to clarify.
Unfortunately.
Yes. So FDA never approves anything. They only clear things. So in other words, they're saying it's cleared to be for sale, but they won't ever approve anything. So they clear it. And, and it depends on whether you want to be a class 1 device, a class 2 device. So there are ways to bring stuff in that may only be a class 1 device. And
what does that mean, Tim? Class 1, class 2?
Well, it has to do with the technology. So whether it's a laser or if it's ablative or if it's going, below the skin. So there's a lot of qualifications on the FDA on what that means. But the class 1 device you can sell it to anyone. It's the class 1 devices are fantastic because you can sell them to anyone, but class 2 devices are your high-end devices. Those are the ones that you can only sell to a physician. That's the place to be.
Okay, and what class device is Frozen C?
Oh, it is a class 2 device.
Oh, so you're not going to be selling this to spas and the country clubs?
No, they have to have a medical director.
So class 2 devices are high-end devices that can only be sold to physicians. And who can operate?
Yeah, that's state by state. So it's really, you'd have to check your state regulations on that. It's state by state, but then it's also, most everyone does recognize that it's really up to the physician to control it because it's the physician's office and they are the medical practitioner and it's really up to them.
So in my practice, the cryofacial, which we have named Kiss of Ice, isn't that an amazing name?
Kiss of Ice. Yes.
That is being performed by my medical estheticians. Then if I use it pre-treatment and post-treatment for a laser or a facial injectable, that's being done by me and my medical assistant in the room together and directed by me. I'm in California, as you know. So going back to devices need to be FDA cleared. They need to be classified as what class they are and who can purchase them and operate them. And there's a lot that the state judges or the state determines who can use a class 2 device.
Yes, they've set those regulations, and then you will find that some dermatologist groups have gone out and they've tightened up the restrictions in certain states, and that's the way that things are rolling right now. But there are some states that are pretty wide open. Florida and Texas are pretty much wide open.
So this is still being manufactured outside. Frozen C is still being manufactured outside of the U.S., but you have the U.S. distribution and world distribution. And I'm curious. I want to know, how many devices did you think you would sell in the first year and where you are compared to that number? You don't have to get specific, but
okay,
I'm really curious.
It's a great question because when I'm talking to the manufacturers and I'm looking at the product and what I do is I go through and I will analyze it, and I've got a team that I work with that we analyze the product, then we look at it, how are we going to market it, what will it do, and what's the return on investment, because if it doesn't make sense financially, it's not going to work, and I also want a product that's going to be at the right price point. There's too many devices out there that they're going after the $80,000, $90,000, $100,000, $200,000 for a piece of equipment. And it's just ridiculous burden on the physicians. I want something that's easy entry. And this is going to be, the reality is right now what we're finding out, this is going to be the new standard of care in every office. It has to be. But when you ask about, how many we've sold and where on that, we did a look at it, and I would say that my initial projection was, let's see, I'm already into this about 6 months, but the projection that I gave them for the year, I'm about 300% to what the quota was. Let's put it that way.
Wow, that's fantastic. So how does a aesthetically oriented consumer then find out who has this device? Let's say our audience wants to come for a cryofacial. How do they find Frozen Sea?
The Instagram page is Frozen Sea Ice, and then the website is frozenseaice.com. Truthfully, we will be putting up a list where you can find the doctors and their locations. The problem that we're having right now is keeping up with it. So I've got a whole new SEO company and website company coming on next month, and we're going to update it and really blow it out that way. But it's been overwhelming. So what we've got is all these systems. We bring them into the U.S. and then realize with the FDA, you have to go through regulatory every time you bring a system in. So we have to go through checks, inspections, and testing every single time. So
how long does that process take?
It can take per unit, getting it through the customs and all that. I will tell you that, sometimes you'll have some headaches and stuff like that. But normally, if everything goes smoothly, we can get through the FDA and the clearances within 5 days. And then when we get it into the home office, then that's probably, per unit, it's a few hours per unit to go through and do all the testing, and then repackage them and rebox them and all that stuff at least.
Then you're telling me that it's days and hours to get an FDA clearance on a device?
No, that's just through customs and getting it through the FDA and customs.
Oh, okay. Yeah. So what do they do? Do they send the dog sniffing or the drug sniffing dogs to make sure that you didn't pack some illegal drugs in the box? Is that what's happening?
That is part of it. Yeah, they look for that stuff. Once you're a established company like we are, we don't have issues like that. But what they do is they want to look at it and make sure that all the serial numbers are right. All our FDA paperwork is correct. So what happens is you hear about some people purchasing devices on Alibaba and stuff like that from worldwide, and they bring them in here. And if they get it through customs, they're pretty lucky because customs doesn't realize what it is. But where they run into a huge risk is if anyone was to, let's say, report an incident, a problem that happened that occurred with that medical device, you're not just liable for that burn, but now the FDA is involved, and the FDA is going to find out that you're using a non-cleared device. Your medical license will be taken. And is it worth the risk of getting a device that hasn't been tested and hasn't been vetted and run through the whole process, but you're saving, $5,000 or $10,000 on it?
I mean, I know that that's a rhetorical question that you're asking, but I'm going to answer it anyway. There's no way that any of the colleagues who I have that have high standards and are delivering not only safe aesthetic medicine, but also result-oriented aesthetic medicine procedures, there's no way that we would ever want to jeopardize our medical license and livelihood and identity over an Me Too type of a product that isn't FDA cleared. FDA is my friend and my patient's friend.
Oh, absolutely. And, and I will tell you that I do have, I've had a number of doctors that have called me up and they've said, Tim, I really like this product and the price point. How can I get this in the U.S.? And then if it's something that's going to work out, I will talk to the company. We'll run it through the FDA and help them and bring it in. So that's, we're open to that. In fact, we even bring in devices and turn around and flip them to other companies.
So then going back to getting an FDA clearance, as this is a safe device that is legal to sell, buy, use in the U.S., how long does that process take? I know that for like a facial injectable, the minimum time that it takes is 18 months to get an FDA answer.
Yeah, and about $300,000. Okay, so
Oh, okay.
yeah.
Minor.
Yes. So really what it is, it depends on the device and the classification and the indications you're going after. So if there's a predicate device, if there's another device that's doing the same thing, then you can piggyback off of their FDA and do a small 30 patient clinical study and submit all your proof sources and everything. That you can get done with my FDA guy. He's done it within 3 months before. But on average, your typical one should take and would take anywhere from 6 months to a year, depending on your relationship with the FDA.
So you didn't piggyback on any other devices because there is nothing like Frozen C in the U.S. that can be safely used on the face.
Correct.
So the body cryo chambers don't count as far as the FDA is concerned when they were looking at your device.
No, they don't. They don't.
So how exciting. You found this in 2017 and had it up and running in 2018?
Yes. Yeah.
Okay. I love asking people that have been in the beauty industry, in the aesthetic beauty industry, what they think beauty is and where they see medicine going.
I love that question.
You do?
Yes, I do. Because for me, it's all about the individual. What do they want that makes them a better themselves? I mean, their better self. And I love the natural responses when they're using their own wound healing. And then you can just enhance it a little bit. You know what? I've got friends, when I go back to, the the school reunions and stuff. And I'm not ashamed to say, yeah, I've had CO2 done. And, because they're saying, you look 10 years younger than, most of the people here. And it's like, well, I don't know why some people aren't doing it. That doesn't make sense to me. It's like, if you're going to go work out and make yourself healthier, you need to make yourself healthier, not only for your face, but your body and just an overall self. And I think that the future is still going towards, I like subtle, natural looking results.
So would you agree that there's no stigma associated with improving what your body looks like, but we're still working through the stigma of wanting to pay attention to what your face looks like and not just beautiful, but also younger looking?
Yeah, I think the stigma is finally starting to drop off. And I will tell you that I think it also has a lot to do with the baby boomers, because the baby boomers have hit that age where it really is like, oh, wait a minute. You know what? I'm getting older. I'm no longer that spring chicken. And I think, it seems like we're all living longer and we're living healthier, but our face and skin is not keeping up with our mentality and our working out and how we feel. They want that to catch up. So they're accepting it. And that's the part where they need to go to trusted physicians like yourself so that they can go in and get the right procedures done and not overdo it and just be safe. And it is now. I mean, it's just so easy. It's incredible.
So where do you see this field going? You obviously have been a serial entrepreneur and have helped companies and devices become popular in the US, and you have the inside information on what's coming. So where do you see this field going?
Well, I have 4 systems that I'm going to be coming out with. One of them is my own invention that I'm talking to a couple of manufacturing sites. We're actually going to develop a manufacturing site as well to build it. And then.
So not only a serial entrepreneur, but also now an inventor.
Yes.
Love it. Okay. So you have a system that you have put together, and what else is happening?
And then I've got about 3 other devices that I'm going to be dropping in and bringing in. And I will say on a daily basis, I'm getting contacted by manufacturers, but it's looking for the right product. And, when I go when I go overseas and I talk to these companies and I look at their devices, one of the things I look for with a manufacturer is how open are they to suggestions of, improving their product. And they have to be honest enough to be able to and have enough self-worth to say, okay, you know what, that makes sense. Let's do it. Because I've done it, and I will tell you that it's about a 25% success rate where the company will go, okay, let's do that. That's a great idea. Let's do this, and they're on board. The problem you have is you have a lot of companies that they built this and it's their baby, and they don't want to change it because they feel like they have so much invested in it. And it's like simple changes, because you have to look at a product and trust me, I look at a product not just for the aesthetic appeal. I would look at it because I want to make sure it's comfortable for the nurses to use. Is it going to be comfortable and aesthetic pleasing for the patient? Then you have to look at it and say, is it comfortable for the sales rep? Is it something that can be demoed very easy? Then what about service? Is service going to be easy? Is this going to be something that's easy to get through the FDA? So you have to look at all those aspects. And when you go to some of these companies, they have never taken in the full spectrum of how to design a product. So you have to redesign them.
So do you also have the pulse of what the consumer is looking for? Because you certainly know what the providers, the group that I'm in, is looking for in new technologies. What is the consumer looking for?
The holy grail of it all. They're always looking for something that's going to get them real results, no downtime, and no pain.
Wow. Are you sitting in my treatment room and reception room? That's true. Our patients are sophisticated. They have very busy lives. They want to be looking better and be a more enhanced version of themselves. They don't want to look like avatars. And for some of them, it's very personal. So they don't want announcements to the whole world that I've done things. So that downtime is the key to most patients deciding whether they can afford to do a treatment. And by afford, I don't mean cost-wise, but by lifestyle.
Correct.
And they don't want to have downtime. So often they will choose to do a treatment that doesn't have downtime, perhaps at a non-medical facility, and not realize that they weren't going to get facelift results with the watered down facial and LED light that is, not useful or not effective. So that's really what the customer wants. You said it, you have the pulse on what the consumer wants. They want things that work. They don't want downtime, and they don't want pain.
I will tell you that the way the future should go, and there was a study, and I've got to get my hands on it. There was a study done out of China with, we're talking thousands of patients, and it was with IPL. And it was the patients that had the IPL treatment once a year for 10 years. They had a dramatic improvement and youthful look than the ones that didn't. And way back when I was running Hoyocom Bio and selling the med lights, one of the big things that I pushed wasn't just the tattoo removal. It was the anti-aging maintenance. It's the maintenance. It's getting that treatment worst case, once a year, getting something. I think if somebody gets on a maintenance plan for their life, because they have to do this for their life. If they don't set up and do that, then they're setting themselves up for failure.
Well, none of us question the fact when the dentist says, I need to see you once a year, twice a year, 3 times a year for your dental hygiene cleaning sessions. None of us question that anymore. And that's what it has distilled down to, based on science, based on studies, that's what you need to do. You need to maintain your look. So the old way of doing things, age until you're in your 50s, 60s, and then do a facelift, has changed to starting early. So pre-rejuvenation, and doing small tweaks, but at regular intervals.
Exactly. And truthfully, it's one of those things where I would want to sell to a patient and say, look, I'm selling you a life plan. Here's your life plan every year. And you base it on their age, and you can just look at them and you can say, look, okay, and this year you're going to come in for 3 sessions. This year you're going to come in for 2. This year you're going to come in for 1. This one you're going to come in 3, because not only are we going to get your sunspots, but now we're going to do some more rejuvenation. And you just lay that out for them and say, here is your life plan. Here's what it is. And you can budget for it and make it part of your life. And I think that is really the future. And I think it's something, it's just like going to a gym, but better.
So I call that the aesthetic journey. So I'm not trying to sell my patients an A to Z plan on the very first visit. And I make it really easy because we're not putting them under anesthesia to do any of this. So they don't need to do everything together. I talk to my patients about how we're going to continue to age. And what's more important to me is that you commit to a journey of becoming a better version of yourself than to do everything all at once. So I kind of discussed that, are you a 1 treatment, 2 treatment, 3 treatment, or 4 treatment kind of a person, depending on the health of your skin, what you've done in the past, what your goals are, and also your age. So, Tim, any last comments or remarks about our audience who are interested in new technologies in this arena?
It's trust your physician and do your research on it. That's the key. It really is. Finding a physician and sticking with somebody that you have the trust with, that knows what they're doing. And you're a perfect example. You're the type of physician that it's like, okay, you know what? Set up a whole life plan and go for it, because you know what you're doing. You're always on the cutting edge of stuff that's happening. I mean,
it's the geek scientist in me.
Yeah, you were one of the first ones with the frozen sea. In fact, I think you were the first one in California with the frozen sea. So it's getting a plan and working with a physician, the right physician.
Well, thank you so much for your time and sharing with us your journey in this world of medical aesthetics. I'm really happy to have discovered the frozen sea, and the science behind it is very interesting. And I'm excited to see what other treatments come from all the research that is happening. So thank you, Tim.
Thank you very much. I really appreciate it.
In summary, cryo devices and treatments using gases is where the future's going. So far, we've had handheld liquid nitrogen devices for skin lesion treatments and nitrogen cryo chambers for sports medicine body treatments. Now we have the frozen sea cryo device for a number of aesthetic treatments. Those include cryofacials for tone and texture improvement, pre- and post-facial injectable, skin tightening, and skin resurfacing treatments for painless treatments and minimizing bruising and swelling, acne treatments for killing the acne-causing bacteria, rosacea treatments for controlling redness and breakouts. Frozen sea uses CO2, not nitrogen. It gets to minus 78 degrees safely, whereas nitrogen gets to minus 200 degrees. Colder isn't necessarily better. What is more important is to do concise and safe treatments that get results and prevent skin from blistering or frostbiting. Frozen sea monitors skin temperature and auto shuts off before a frostbite can occur. The science behind it include well-known facts. Bohr's effect has to do with CO2, gas, and oxygen starvation, and the Hunter's effect has to do with vasoconstriction leading to vasodilation. These cause collagen and elastin formation in the skin. We also learned that anyone bringing a medical device for use in the U.S. must go through regulatory process and FDA clearance. And as a consumer, staying with FDA-cleared devices at medically sound practices will protect you from untoward effects. Thank you for listening.